Hello. A variety of inhaler devices are available to treat lung conditions. This video will show you how to use your Breezhaler inhaler. If you use your inhaler correctly, you'll get more of the medication into your lungs, giving you better control of your breathing problem. But if used incorrectly, you may have poor control of your condition, with the risk of side effects, such as a sore throat or mouth infection. You'll need to have the Breezhaler capsules to hand when using your inhaler. These capsules can only be used in the Breezhaler. Do not swallow the capsules. Keep the capsules in the blister pack until ready to use. You should always sit upright or stand up when using your Breezhaler. Begin by removing the protective cap. Open the Breezhaler by holding the base in one hand and then using your other hand to tilt the mouthpiece backwards to reveal a capsule compartment in the base of the inhaler. Separate the blister containing the capsule from the blister pack by tearing along the perforations. Peel away the plastic covering to expose the capsule. Do not push the capsule through the foil, as this may damage the capsule. Make sure your hands are dry before removing the capsule and placing it into the capsule compartment in the inhaler. Close the inhaler by tilting the mouthpiece back until you hear a click. Hold the inhaler upright with the mouthpiece pointing upwards. Firmly press the two buttons on the base of the inhaler at the same time and then release. You will hear a click, which means the medication has been released from the capsule. Only do this once. The inhaler is now ready to be used. When you're ready, breathe out gently as far as you comfortably can, but not into the mouthpiece. Now place the mouthpiece into your mouth and between your teeth, but don't bite down on it. Close your lips around the mouthpiece to form a tight seal. The side buttons should be facing left and right. Do not press the side buttons. Take a deep breath in, quickly but steadily. You should hear a whirring noise as the capsule spins in the inhaler, and you may taste the medication in your mouth. If you do not hear a whirring sound, you've not taken a deep enough or quick enough breath, or the capsule is stuck and needs to be repositioned by opening the Breezhaler. After you have heard the whirring sound, remove the inhaler from your mouth while holding your breath for up to 10 seconds, or for as long as is comfortable. Now breathe out slowly. Don't worry if you cough after using the Breezhaler. Open the inhaler as before to see if there's any medication in the capsule. If there is, you need to repeat the process again, but you don't need to squeeze the buttons as the capsule has already been pierced. Once you are happy that you have had all of the medication from the capsule, throw the capsule away into your normal household waste and close your Breezhaler. Replace the cap and store your inhaler in a dry place. If your inhaler contains a steroid, brush your teeth or rinse your mouth with water and spit it out after every use to prevent mouth infections. Ask your pharmacist if you're unsure whether your inhaler contains a steroid. If you're unsure about how to use your Breezhaler or have any other questions, speak to your GP, practice nurse or pharmacist for assistance.